again, everyone. Let's dive right into the deep end. The number of college athletes who died by suicide between 2002 and 2022 doubled, according to a study in the British Journal of Sports Medicine.
Suicide is now the second most common cause of death in this group. Joining us to continue the conversation from the ARC Lounge this morning is Dr. Kimberly Harmon, the head of sports medicine at UW Medicine and team physician for the Huskies, and Bridget Whelan, a family medicine research scientist at UW Medicine. Let's dive right into the numbers here. Can you expand on what this study found about suicides among college athletes and how those numbers differed when it comes to sex, race, and sport?
Sure. So as mentioned, the study covered 20 years of data, and we found that the rate of suicide in this population was increasing over time. But then when divided out between the differences between male and female athletes stayed somewhat stagnant for the first 10 years, but then really started to dramatically increase over the second 10 years, whereas the rate of in males was rising the entire time. When we divided it out by sport, none of these results were statistically significant, but we did notice differences, with the highest rates being in male cross-country and track and field athletes, which was surprising to us because typically those are sports that are not often covered in the media, whereas a lot of stories had previously been on football athletes and basketball and soccer.
Yeah, I think what was just really concerning was just that increasing rate of suicide, and we'd certainly noted that in other populations, in the general population, but we think of athletes as a healthier segment, and so we were concerned about seeing that, and so.
It is quite the concern. Maybe you can touch on why we are seeing such an alarming increase in the number of suicides among college athletes?
I think a big part of that is that they are more widely covered than your average college student. Social media in particular that's a huge part of their identity and the promotion of their sport. And so they have just a lot more attention on them, and they have a lot more opportunity for individuals to make comments about them, many positive, many fans, but also anybody who criticizes them, they see that and they hear that much more so than the average college student. And so I think that can contribute to their mental health and certainly adds to the pressures that they're already facing.
Sorry, you can continue.
Oh, I was just going to say, I think it's important to point out that this study wasn't designed to look at the causes of suicide, and so what it really just noted was this increase in amount. We can speculate why suicide might be going up in this population, in our general population, and many people have pointed to social media and other causes. But the study wasn't really designed to look at the reasons behind this, but certainly it definitely shows this alarming increase in the rates of suicide in athletes, who we think of as a really healthy segment of society.
Okay, let's talk about action here. Has the NCAA taken any kinds of steps to prevent future suicides or address mental health? And what do you recommend in terms of helping to prevent suicides in this very particular specific group?
Well, maybe I'll talk about what the NCAA has done, and then Bridget can talk about sort of future actions. So the NCAA, mental health has been a significant focus over the last 10 years. And so they've put out a mental health toolkit with mental health best practices. They've recommended that there be psychological support for all these athletes. They've recommended screening on a regular basis. And so there has been a real emphasis, because the need has been seen over the last decade, and certainly the last 5 years. And despite this increasing focus on mental health in athletes, we're still seeing this increase. And so I think that just shows us that we need to do more.
Yeah, and in terms of future action, screening is one of the best things that we can do. We don't really have a sense of, when somebody's facing some issues, and so being able to better understand what red flags to look for, what warning signs, and then being able to ask questions. One of the hardest things to do is have a conversation with somebody about whether or not they're considering suicide, but there's lots of tools out there. In particular, there's one organization we work with, Forefront, at the University of Washington, and they have a great toolkit that really helps you understand what to look for and then how to have that communication with them, but then also how to connect them to services. There's also the suicide hotline 988, which is an anonymous way for somebody to call and receive help. You can call or text, and really just better having better access to services. So I think once we understand, we can be able to see these red signs and be able to realize that somebody may need help, then being able to get them into that care. And so the suicide hotline is a great way to connect with somebody, but really we need to have more accessible care to psychologists and other individuals, mental health providers that can help people through this hard time.
And empowering people to just ask those around them if they are okay. Thank you both so much for your time today. We appreciate you sharing some of that important information with us.
Thank you.
Thank you for having us.
Again, if you or someone you know is contemplating suicide, you are never alone. There is help out there. You can either call a suicide crisis lifeline. They showed that number. We'll put it up again for you at 988 for 24-hour free confidential support. You can go to 988lifeline.org as well. I think one particular case that thrust this topic into a lot of the headlines, at least here locally, was when WSU's football quarterback Tyler Hilinski committed suicide back in 2018, and that was one of those cases. They mentioned football gets a lot of coverage, and that was invoking a lot of CTE and looking at what some of those things done. So it was very interesting to hear the track and field angle of it, because so much has been focused on brain trauma and maybe not necessarily some sports that don't involve that kind of physical contact.
Yeah, contact sports. It affects everybody. Yeah, and not just student athletes, but everyone. Anyone could deal with suicidal thoughts or thoughts of depression. So always good to know about those resources and ways to get help. And that number still at the bottom of your screen.